Hello everyone, this is Sabrena McCarley. On Tuesday, April 4th, CMS released the fiscal year 2024 Skilled Nursing Facility Prospective Payment System Proposed Rule. And I wanted to take this opportunity to highlight some of the key areas that would impact therapy providers. In regards to the minimum staffing requirement, we should see proposals for direct care staffing requirements in nursing homes in the rulemaking within the spring. Fiscal year 2024 proposed updates to the SNF payment rates, which would not include the SNF VBP reductions. CMS is estimating the aggregate impact of the payment policies in the proposed rule would result in a net increase of 3.7%. There are also several proposed changes to the PDPM ICD-10 code mapping. In there, it does include the proposed clinical category changes for unspecified substance use disorder codes. Within the proposed changes to the Skilled Nursing Facility QRP program, CMS is proposing the adoption of 3 measures, the removal of 3 measures, and the modification of 1 measure. In addition, this proposed rule would also make policy changes within the SNF QRP and begin public reporting of 4 measures. The proposed adoption measures include the Discharge Functional Score measure beginning in fiscal year 2025, Core Q, the Short Stay Discharge measure beginning in fiscal year 2026. COVID-19 vaccine would be the percent of patient residents who are up to date on their COVID-19 vaccine measure, and this would begin in fiscal year 2026. The proposed removal measure would be the application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses function, and this would begin in fiscal year 2025. Proposed modification to the COVID-19 vaccine coverage among healthcare personnel measure, and this would begin in fiscal year 2025. And proposed public reporting would include the transfer of health information to the provider, a PAC measure, transfer of health information to the patient, a PAC measure, and this would begin October of 2025 care compare refresh or as soon as technically feasible. The proposed changes to the Skilled Nursing Facility Value Based Purchasing Program, CMS is proposing the adoption of 4 new quality measures, the replacement of 1 quality measure, and several policy changes within the SNF VBP program. This would include adding a nursing staff turnover measure, and this would be for fiscal year 2026, adding the Discharge Functional Score measure beginning in fiscal year 2027, adding long stay hospitalization measure per 100 residents beginning in fiscal year 2027 program year, adding adoption of the percent of residents experiencing 1 or more falls with a major injury as a long stay beginning with the fiscal year 2027 program year, replace the skilled nursing facility 30-day all-cause readmission measure within skilled nursing facility stay potentially preventable readmissions measure, and this would begin in fiscal year 2028 program year. They are also proposing several health equity adjustments beginning in fiscal year 2027. Additionally, there's a proposed change to the civil money penalties, and this is the CMP, waiver of hearings, the reduction of penalty amounts. Additionally, there is a proposed change within the consolidated billing, which would be effective with services furnished on or after January 1st, 2024. What would happen is the addition of marriage and family therapists and mental health counselors to the list of practitioners within sections 1888E2 of the Act, whose services are excluded from the consolidated billing provision. CMS is also seeking additional information from providers on a variety of items. We encourage you to review the proposed rule and to submit your comments. Thank you.